Question 1. A 32-year-old client presents with recurrent panic attacks, intense worry about future events, and significant avoidance of social situations, making it difficult to maintain employment. She reports feeling on edge most days for the past 7 months, experiencing muscle tension and difficulty concentrating. Her panic attacks sometimes occur spontaneously, but are often triggered by social gatherings. Based on this information, which of the following diagnoses is most appropriate? A. Social anxiety disorder. B. Generalized anxiety disorder. C. Panic disorder. D. Agoraphobia. Answer: C. Panic disorder. The concept tested here is differential diagnosis within anxiety disorders, specifically distinguishing between panic disorder, generalized anxiety disorder, and social anxiety disorder. The key clue is the recurrent panic attacks, which sometimes occur spontaneously, combined with the intense worry and feeling on edge most days for an extended period, which points to the underlying anxiety driving the panic. While the client also experiences social avoidance, the primary and most acute distress appears to be from the panic attacks themselves, which are a hallmark of panic disorder. Panic disorder often co-occurs with other anxiety disorders, but the presence of recurrent, unexpected panic attacks is the defining feature. For example, if the client's main concern was only social situations, social anxiety disorder might be primary, but the spontaneous panic attacks suggest a broader panic disorder. Remember, panic disorder is characterized by unexpected, recurrent panic attacks, often leading to worry about future attacks. Question 2. A seasoned counselor is working with a client who reports experiencing significant distress due to a recent job loss and subsequent financial difficulties. During sessions, the client frequently expresses feelings of hopelessness and worthlessness, but also shows a surprising level of resilience, actively engaging in job searches and budgeting. The counselor finds themselves increasingly drawn to fix the client's financial problems, spending time researching local resources outside of session and feeling personally responsible for the client's success. This situation most likely indicates A. Countertransference. B. Empathic understanding. C. Professional burnout. D. Compassion fatigue. Answer: A. Countertransference. This question assesses understanding of common therapeutic concepts, particularly countertransference. The key clues are the counselor finding themselves increasingly drawn to fix the client's financial problems and feeling personally responsible for the client's success, which points to the counselor's own unresolved issues or unconscious reactions influencing their professional objectivity. Countertransference occurs when the counselor's own emotional reactions, past experiences, or unresolved conflicts impact their perception of an interaction with the client. It's important to distinguish this from empathy, which is understanding the client's feelings without taking ownership of them. For example, if a counselor grew up in poverty, they might over-identify with a client facing financial hardship, leading to countertransference. Remember, recognizing your own emotional responses to a client is crucial for maintaining therapeutic boundaries and effectiveness. Question 3. A 16-year-old client is referred for counseling after displaying increased irritability, social withdrawal, and a noticeable decline in academic performance over the past 5 months. During the intake, the client admits to using cannabis daily for the past year, stating it helps them relax and forget about school. The client's parents are unaware of the cannabis use but are concerned about their child's overall mood and behavior. Which of the following is the most appropriate initial action for the counselor? A. Inform the parents immediately about the client's cannabis use due to their age. B. Focus solely on the academic decline and social withdrawal, deferring discussion of cannabis use. C. Discuss the limits of confidentiality with the client, including parental rights and potential risks, and explore their willingness to involve parents in treatment. D. Report the cannabis use to school authorities as it affects academic performance. Answer C. Discuss the limits of confidentiality with the client, including parental rights and potential risks, and explore their willingness to involve parents in treatment. This question tests the counselor's understanding of confidentiality with minor clients, specifically regarding substance use. The crucial aspect here is the client's minor status and the ethical and legal complexities of confidentiality when parents are involved. Before disclosing any information, it is imperative to discuss the limits of confidentiality with the minor client, including their parents' legal rights to information and the potential risks of the substance use, and then explore the client's willingness to involve their parents in treatment planning. This approach respects the minor's autonomy while also addressing the parent's right to be informed about serious risks, aligning with ethical codes that prioritize client welfare and informed consent. For instance, explaining to the client that while the counselor wants to build trust, there might be situations where parental involvement is legally or ethically mandated can help them understand the delicate balance. Always start by educating the client about confidentiality and discussing potential disclosures before acting unilaterally. Question 4. A client, recently diagnosed with a terminal illness, expresses profound sadness and states, "I just want it all to end." They describe having fleeting thoughts of ending their life but deny having a specific plan or immediate intent. The counselor's primary ethical and clinical responsibility is to A. Immediately contact emergency services to have the client hospitalized for suicidality. B. Normalize the client's feelings and shift the focus to exploring their grief over the diagnosis. C. Conduct a thorough suicide risk assessment, explore protective factors, and develop a safety plan with the client. D. Consult with the client's medical doctor to determine if medication for depression is warranted. Answer C. Conduct a thorough suicide risk assessment, explore protective factors, and develop a safety plan with the client. This question centers on the critical counseling concept of suicide risk assessment and intervention. The keywords "fleeting thoughts of ending their life but deny having a specific plan or immediate intent" are crucial. While there's ideation, the absence of a concrete plan or immediate intent suggests that immediate hospitalization might be premature without further assessment. The primary responsibility is to systematically assess the level of risk, which includes exploring the nature and frequency of ideation, any past attempts, current triggers, and protective factors, reasons for living, support system. A safety plan, which outlines steps the client can take to remain safe, is a standard and essential intervention when there is suicide ideation. For example, a safety plan might include identifying coping strategies, contact numbers for support, and steps to remove lethal means. Always remember that a comprehensive risk assessment and safety planning are fundamental steps when a client expresses suicidal thoughts, even fleeting ones. Question 5. During a group counseling session, a member consistently monopolizes discussions, interrupts others, and offers unsolicited advice, causing other members to withdraw. The group leader's most appropriate action to address this behavior while maintaining group cohesion would be to A. Directly confront the member about their disruptive behavior and ask them to leave if it continues. B. Ignore the behavior, hoping it will naturally subside as the group progresses. C. Facilitate a discussion with the group about the impact of the behavior on their participation and invite the member to reflect. D. Reassign the member to a different group that might be a better fit for their communication style. Answer C. Facilitate a discussion with the group about the impact of the behavior on their participation and invite the member to reflect. This question tests the counselor's ability to manage group dynamics effectively and ethically. The key challenge is to address disruptive behavior, monopolizes discussions, interrupts others, while preserving group cohesion. Directly confronting the member or removing them might alienate them and disrupt the group further, while ignoring the behavior is ineffective. The most appropriate approach is to use the group process itself to address the issue. By inviting the group to discuss the impact of the behavior, the leader creates a learning opportunity for the disruptive member to gain insight and for other members to voice their concerns in a constructive way. For example, the leader might say, "I've noticed that when X speaks for an extended time, some other members become quiet. How is this impacting your ability to share?" This allows the group to provide feedback and promotes self-reflection. Remember, addressing group challenges through group process fosters a stronger, more therapeutic environment for all members. Question 6. A client in long-term therapy reveals that they have been actively posting negative and disparaging comments about the counselor on social media, using pseudonyms. The counselor discovers these posts during a routine online search. The most appropriate initial ethical action for the counselor is to A. Immediately terminate the therapeutic relationship due to a breach of trust and potential harm to the counselor's reputation. B. Discuss the social media posts with the client in session, addressing the impact on the therapeutic relationship and ethical boundaries. C. Contact an attorney to explore legal options regarding defamation and potential damage to professional standing. D. Ignore the posts, understanding that clients have a right to express their feelings, even negatively. Answer B. Discuss the social media posts with the client in session, addressing the impact on the therapeutic relationship and ethical boundaries. This question evaluates the counselor's ethical response to a complex situation involving client behavior outside of session that impacts the therapeutic relationship. The concept tested is maintaining ethical boundaries and addressing challenges within the therapeutic context. The most appropriate initial action is to bring the issue into the therapy room for discussion. This upholds the therapeutic alliance by allowing the client to address their behavior and for the counselor to explore the underlying reasons for it, while also setting boundaries and discussing the ethical implications for the professional relationship. Terminating immediately or seeking legal action bypasses the therapeutic opportunity, and ignoring it could tacitly condone damaging behavior. For instance, the counselor might say, "I've become aware of some online posts that seem to refer to our work together. I'd like to understand what you're hoping to achieve by posting these, and how this impacts your feelings about our sessions." Remember, addressing boundary issues directly within the therapeutic relationship, when safe and appropriate, often leads to deeper understanding and growth. Question 7. A counselor receives a subpoena for a client's records from an attorney representing the client's ex-spouse in a custody dispute. The client had previously expressed a desire for their records to remain confidential and has not given consent for their release. The subpoena does not include a court order signed by a judge. What is the counselor's most appropriate initial response? A. Immediately send the requested records to the attorney as legally required by the subpoena. B. Inform the client about the subpoena and seek their written consent or guidance on how to respond. C. Contact the attorney and refuse to provide the records, citing client confidentiality. D. Submit only a summary of the client's records, withholding sensitive information. Answer B. Inform the client about the subpoena and seek their written consent or guidance on how to respond. This question tests the counselor's understanding of confidentiality, legal obligations, and client rights in the face of a subpoena. The crucial detail is that the subpoena is from an attorney and does not include a court order signed by a judge, meaning it's not a direct court mandate yet. Therefore, the counselor's primary ethical and legal obligation is to protect client confidentiality. The most appropriate first step is to inform the client about the subpoena, discuss its implications, and ascertain their wishes regarding the release of information. The client then has the option to provide consent, contest the subpoena, or seek legal counsel. For example, the counselor would explain the subpoena to the client and say, "You have the right to object to the release of these records. How would you like me to proceed?" Always prioritize involving the client and obtaining their informed consent or direction when faced with a request for confidential records that isn't a direct court order. Question 8. A family presents for counseling, reporting frequent intense arguments, a lack of communication, and a general feeling of disconnection. The identified client is the teenage daughter, who has recently started acting out in school. From a systems perspective, the counselor would initially focus on A. The daughter's individual behavioral issues and developing strategies for her to cope with family stress. B. Identifying the family's communication patterns, power dynamics, and boundaries. C. Referring the daughter for individual therapy to address her acting out behaviors separately. D. Diagnosing the daughter's specific mental health condition that is contributing to the family dysfunction. Answer B. Identifying the family's communication patterns, power dynamics, and boundaries. This question assesses the application of a family systems theoretical perspective. The keyword from a systems perspective is the key clue, guiding the answer away from individual pathology. A family systems approach views an individual's problems as symptoms of dysfunctional patterns within the family unit rather than solely individual issues. Therefore, the initial focus would be on understanding the relational dynamics, how family members interact, their roles, communication styles, and the permeability of their boundaries. For instance, instead of asking why is the daughter acting out, a systems counselor would ask, what role does the daughter's acting out play in maintaining the family's current equilibrium or patterns? Remember, in family systems, the problem is often seen as residing in the interactions and patterns of the system itself, not just one individual. Question 9. A client in recovery from opioid use disorder reports feeling overwhelmed by cravings and a strong urge to use after a particularly stressful day at work. They deny immediate intent to use but express fear of relapse. The most appropriate intervention at this moment is to A. Immediately refer the client to an inpatient detoxification program. B. Encourage the client to distract themselves with a pleasant activity. C. Explore the specific triggers and develop immediate coping strategies within the session. D. Remind the client of the negative consequences of relapse. Answer C. Explore the specific triggers and develop immediate coping strategies within the session. This question tests the counselor's ability to provide immediate and effective support for a client experiencing relapse triggers. The keywords overwhelmed by cravings and a strong urge to use and fear of relapse indicate a high-risk situation that requires direct intervention. While distraction can be helpful, it's a short-term band-aid. The most appropriate intervention is to actively engage with the client in identifying the specific triggers, stressful day at work, and collaboratively developing concrete, immediate coping strategies they can implement right away to manage the cravings and urges. This empowers the client and strengthens their self-efficacy in recovery. For example, this might involve practicing mindfulness techniques, calling a sponsor, or using a specific grounding exercise right there in the session. Remember, helping a client develop and practice immediate coping skills for cravings is crucial in preventing relapse. Question 10. A university counseling center director is reviewing the effectiveness of their services. They want to determine if students who receive counseling demonstrate a statistically significant reduction in self-reported anxiety symptoms compared to students who only utilize self-help resources. Which research design would be most appropriate for this evaluation? A. Qualitative case study. B. Experimental design with random assignment. C. Correlational study. D. Phenomenological study. Answer B. Experimental design with random assignment. This question assesses knowledge of research methodology, specifically choosing the most appropriate design for evaluating program effectiveness. The key phrase, statistically significant reduction in self-reported anxiety symptoms compared to students who only utilize self-help resources, indicates a need to establish causality or strong evidence of an intervention's impact. An experimental design with random assignment is the gold standard for this type of evaluation because it allows for the manipulation of an independent variable, counseling versus self-help, and minimizes the influence of confounding variables, thereby increasing confidence that any observed differences are due to the intervention itself. For example, randomly assigning students to either a counseling group or a self-help group helps ensure that the two groups are comparable at the outset. Remember, to demonstrate cause and effect and evaluate the efficacy of an intervention, an experimental design with random assignment is typically the most robust choice. Question 11. A 45-year-old client reports chronic feelings of emptiness, unstable self-image, intense fear of abandonment, and recurrent suicidal gestures when feeling rejected. These patterns have been present since early adulthood, significantly impairing their relationships and occupational functioning. Despite efforts to maintain stability, their mood shifts rapidly, and they often engage in impulsive behaviors. The most appropriate diagnosis, considering these pervasive and enduring patterns, is A. Bipolar II disorder. B. Major depressive disorder, recurrent, severe. C. Borderline personality disorder. D. Cyclothymic disorder. Answer C. Borderline personality disorder. This question tests the ability to accurately diagnose a personality disorder based on a constellation of persistent symptoms. The key clues are chronic feelings of emptiness, unstable self-image, intense fear of abandonment, and recurrent suicidal gestures when feeling rejected, alongside rapid mood shifts and impulsive behaviors. These symptoms, present since early adulthood and significantly impairing functioning, are highly characteristic of borderline personality disorder, BD. While there are mood shifts, they are often reactive and less sustained than in bipolar disorder. BPD is defined by a pervasive pattern of instability in interpersonal relationships, self-image, and affects, and marked impulsivity. For example, the client's fear of abandonment often leads to frantic efforts to avoid real or imagined separation. Remember, look for a long-standing pattern of interpersonal, self-image, and emotional instability when considering borderline personality disorder. Question 12. A counselor is developing a treatment plan for a client with generalized anxiety disorder, GAD. The client expresses a desire for practical strategies to manage their chronic worry and muscle tension. Which of the following therapeutic approaches would be most directly aligned with the client's stated goals and is empirically supported for GAD? A. Psychodynamic therapy. B. Cognitive behavioral therapy, CBT. C. Solution-focused brief therapy, SFBT. D. Person-centered therapy. Answer B. Cognitive behavioral therapy, CBT. This question evaluates the counselor's knowledge of evidence-based practices for specific disorders. The concept is matching therapeutic approaches to client needs and diagnoses. The keywords generalized anxiety disorder, GAD, practical strategies to manage their chronic worry and muscle tension, and empirically supported strongly point to cognitive behavioral therapy, CBT. CBT is highly effective for GAD because it directly addresses the cognitive distortions, e.g., catastrophizing, overestimation of threat, and behavioral components, e.g., avoidance, safety behaviors, associated with chronic worry. It teaches clients skills like cognitive restructuring, relaxation techniques, and exposure to anxiety-provoking situations. For example, a CBT intervention for GAD might involve identifying distorted thoughts about a future event and challenging them with evidence. Always consider CBT as a primary, empirically supported approach for anxiety disorders, especially when practical symptom management is a client's goal. Question 13. A client reports significant distress due to persistent intrusive thoughts about having harmed someone, even though they have no memory of doing so and no evidence suggests it. They engage in repetitive checking behaviors, such as repeatedly reviewing security camera footage or asking family members for reassurance, to reduce their anxiety. These behaviors consume several hours a day. This presentation is most consistent with A. Post-traumatic stress disorder, PTSD. B. Obsessive-compulsive disorder, OD. C. Generalized anxiety disorder, GAD. D. Panic disorder. Answer, B. Obsessive-compulsive disorder, OD. This question tests the ability to differentiate between anxiety-related disorders based on specific symptom clusters. The keywords persistent intrusive thoughts about having harmed someone, obsessions, and repetitive checking behaviors to reduce their anxiety, compulsions, that consume several hours a day are classic indicators of obsessive-compulsive disorder, OD. While anxiety is present in all the options, OCD is uniquely characterized by these distinct obsessions and compulsions. For instance, a client with OCD might repeatedly check that their door is locked, compulsion, to alleviate the fear that someone might break in, obsession. Remember, the combination of specific, unwanted thoughts, obsessions, and repetitive behaviors or mental acts performed to neutralize those thoughts, compulsions, is the hallmark of OCD. Question 14. A counselor working in a private practice begins to experience increasing financial strain due to a significant drop in client referrals. To supplement income, the counselor starts offering life coaching services online, separate from their counseling practice, but using their professional counseling credentials in marketing materials for both services. This situation primarily raises concerns regarding A. Counselor competence. B. Informed consent. C. Dual relationships and misrepresentation. D. Client privacy. Answer, C. Dual relationships and misrepresentation. This question focuses on critical ethical standards related to professional conduct and marketing. The core concept being tested is the ethical boundary of dual relationships and accurate representation of services. Using counseling credentials for life coaching blurs the line between two distinct professions, potentially leading to client confusion, misrepresentation of services, and the creation of an undisclosed dual relationship where the counselor is acting in two different professional capacities for the same or similar population without clear delineation. This could mislead potential clients about the scope of practice and the ethical guidelines governing the life coaching service. For example, a client seeking life coaching might mistakenly believe they are receiving regulated mental health counseling services. Always ensure that your professional roles are clearly defined and that marketing accurately reflects the services provided to avoid misrepresentation and maintain clear ethical boundaries. Question 15. A client with a long history of recurrent major depressive disorder, currently in remission, expresses fear about another depressive episode. They want to proactively build skills to prevent relapse. Which evidence-based intervention would be most suitable for this preventative goal? A. Eye movement desensitization and reprocessing, EMDR. B. Mindfulness-based cognitive therapy, MBCT. C. Exposure and response prevention, ERP. D. Interpersonal psychotherapy, IPT. Answer, B. Mindfulness-based cognitive therapy, MBCT. This question assesses knowledge of specific evidence-based interventions and their primary applications. The key phrase, prevent another depressive episode for a client with recurrent major depressive disorder, currently in remission, is a strong indicator. Mindfulness-based cognitive therapy, MBCT, was specifically developed to prevent relapse in individuals with recurrent depression by teaching them to become more aware of and disengage from negative thought patterns and emotional states that can trigger a depressive episode. While other therapies listed have their uses, MBCT directly addresses relapse prevention for depression. For instance, MBCT helps individuals notice the early warning signs of a downturn without judgment, allowing them to respond skillfully rather than reactively. Always remember that MBCT is a robust intervention for preventing depressive relapse. Question 16. A client from a collectivist culture expresses reluctance to discuss personal family issues in individual counseling, stating it would be disrespectful to their elders and bring shame upon their family. The counselor's most culturally competent response would be to A. Explain the importance of individual expression and confidentiality in Western counseling models. B. Reassure the client that what is discussed will remain confidential, thereby alleviating their concerns. C. Explore the client's cultural values regarding family, respect, and communication, and adapt the counseling approach accordingly. D. Suggest that the client bring a family member to the session to facilitate communication. Answer: C. Explore the client's cultural values regarding family, respect, and communication, and adapt the counseling approach accordingly. This question tests the counselor's cultural competence and sensitivity. The key is recognizing that the client's reluctance to discuss personal family issues stems from their collectivist culture and values of respect and avoiding shame. A culturally competent response involves validating and exploring these values rather than imposing a Western individualistic framework. The counselor should seek to understand the client's cultural lens and then collaboratively adapt the counseling process to align with their values, which might involve different communication styles, goals, or even alternative forms of support. For example, instead of pushing for individual self-disclosure, the counselor might explore how the client navigates their family role while still finding personal relief, or focus on external solutions that respect family harmony. Remember, true cultural competence means understanding and adapting to the client's worldview, not just applying universal techniques. Question 17. A counseling intern regularly attends supervision sessions but frequently minimizes their clinical challenges, portrays clients as making rapid progress, and avoids discussing difficult ethical dilemmas. The supervisor observes a discrepancy between the intern's reports and their actual clinical performance as noted in case notes. The supervisor's most appropriate ethical action is to A. Immediately report the intern to the university program for potential ethical misconduct. B. Confront the intern directly about the perceived dishonesty and demand more accurate reporting. C. Explore the intern's reluctance to disclose challenges, provide a safe space for vulnerability, and offer constructive feedback. D. Increase the frequency of supervision sessions and demand more detailed progress reports. Answer: C. Explore the intern's reluctance to disclose challenges, provide a safe space for vulnerability, and offer constructive feedback. This question addresses ethical and supervisory responsibilities when an intern is struggling with self-disclosure and accuracy in supervision. The concept tested is fostering a productive supervisory relationship while ensuring client welfare. The most appropriate action is to first explore the intern's behavior within the supervisory relationship. This involves creating a safe and supportive environment where the intern feels comfortable being vulnerable and can understand the importance of accurate reporting, while also providing constructive feedback on their performance. Directly confronting them or reporting them immediately might shut down communication and prevent the intern from learning. For instance, the supervisor might say, I've noticed a pattern in our discussions where challenges seem minimized. Can you help me understand what might be happening when you prepare for supervision? Remember, the primary goal of supervision is the growth and development of the supervisee and the protection of clients, which requires an open and honest dialogue. Question 18. A client presents with a history of recurrent distressing dreams, flashbacks, and significant avoidance of social situations following a serious car accident 6 months ago where they sustained minor physical injuries but witnessed a fatality. They also report hypervigilance and difficulty sleeping. Their symptoms significantly interfere with their ability to return to work. Which diagnosis is most appropriate? A. Acute stress disorder. B. Adjustment disorder. C. Post-traumatic stress disorder, PTSD. D. Panic disorder with agoraphobia. Answer, C. Post-traumatic stress disorder, PTSD. This question assesses the ability to accurately diagnose post-traumatic stress disorder, PTSD. The key clues are the recurrent distressing dreams, flashbacks, and significant avoidance of social situations following a serious car accident, combined with hypervigilance and difficulty sleeping. The fact that these symptoms have persisted 4-6 months ago is crucial because acute stress disorder is diagnosed for symptoms lasting up to 1 month, while PTSD requires symptoms for more than 1 month. The presence of intrusive symptoms, dreams, flashbacks, avoidance, negative alterations in cognitions and mood, and alterations in arousal and reactivity all strongly align with the diagnostic criteria for PTSD. For example, the client's avoidance of social situations might stem from the fear of encountering triggers or discussing the accident. Remember, the duration of symptoms, over 1 month, after exposure to a traumatic event is a key differentiator for PTSD. Question 19. A counselor is working with a client who identifies as non-binary and expresses frustration with societal binary gender expectations. The client states they often feel invisible or misunderstood in mainstream settings. The counselor, aiming for an advocacy-oriented approach, should primarily focus on A. Helping the client adjust to societal norms to reduce their discomfort. B. Educating the client about the history and origins of gender binary systems. C. Empowering the client to navigate and challenge systemic gender biases and advocating for inclusive practices. D. Focusing on individual coping skills for managing personal distress related to their identity. Answer, C. Empowering the client to navigate and challenge systemic gender biases and advocating for inclusive practices. This question tests the counselor's understanding of advocacy and social justice in counseling, particularly for marginalized populations. The key phrase aiming for an advocacy-oriented approach is central. While individual coping skills are important, an advocacy approach extends beyond the individual to address systemic issues. It involves empowering the client to navigate and challenge societal biases and working at systemic levels to promote inclusive practices. This could include helping the client develop self-advocacy skills, connecting them with community resources, or even the counselor engaging in advocacy at an institutional level. For example, helping a client draft an email to their employer requesting gender-neutral restroom access is an act of advocacy. Remember, advocacy in counseling means working to remove systemic barriers and promote social justice, not just helping individuals adapt to oppressive systems. Question 20. A couple seeks counseling due to persistent arguments about parenting styles. One parent believes in strict discipline, while the other favors a more permissive approach. During a session, they begin to argue intensely, with raised voices and personal attacks. The most effective initial intervention by the counselor is to A. Allow them to continue arguing to observe their natural communication patterns. B. Take a side, supporting the parent whose approach seems more aligned with healthy development. C. Interrupt the argument, acknowledge the strong emotions, and help them identify the underlying needs or fears fueling the conflict. D. Recommend a temporary separation for the couple to reduce immediate conflict. Answer: C. Interrupt the argument, acknowledge the strong emotions, and help them identify the underlying needs or fears fueling the conflict. This question assesses the counselor's ability to manage conflict in couples counseling and intervene effectively. The keywords argue intensely, with raised voices and personal attacks indicate that the interaction has become unproductive and potentially damaging. The most effective initial intervention is to interrupt the destructive pattern, acknowledge the intensity of their emotions, and then shift the focus from the surface-level argument to the deeper, unmet needs or fears that drive the conflict. This helps de-escalate the situation and creates an opportunity for more constructive communication. For instance, the counselor might say, "I can see how deeply you both feel about this. Let's pause and talk about what each of you truly needs and fears when it comes to your child's upbringing." Remember, a counselor's role in intense conflict is often to interrupt dysfunctional patterns and guide clients toward understanding underlying emotions and needs. Question 21. A client reports experiencing significant memory gaps, finding themselves in unfamiliar places without recall of how they got there, and sometimes feeling as if they are observing their own life from outside their body. They also mention that different parts of themselves seem to take over at times, leading to confusion and distress. These symptoms are most indicative of A. Schizophrenia. B. Dissociative identity disorder. C. Borderline personality disorder. D. Depersonalization/derealization disorder. Answer: B. Dissociative identity disorder. This question tests the ability to recognize specific symptoms of dissociative identity disorder, D-Day. The key clues are significant memory gaps, finding themselves in unfamiliar places without recall, feeling as if they are observing their own life from outside their body, depersonalization, and most significantly, different parts of themselves seem to take over at times. This complex constellation of symptoms, particularly the presence of distinct identity states, the parts taking over, with associated amnesia, is the hallmark of dissociative identity disorder. While depersonalization/derealization is present, the key to DID is the identity fragmentation. For example, a client might report finding notes written in a handwriting they don't recognize, or being told they acted in ways completely foreign to their usual personality. Remember, the presence of distinct parts or alternate identities, along with significant memory gaps, is a strong indicator of dissociative identity disorder. Question 22. A client is considering career change and expresses feelings of uncertainty and fear about leaving their current stable, but unfulfilling, job. They have many interests but struggle to narrow down options or take concrete steps. From a constructivist career counseling perspective, the counselor would primarily focus on A. Administering a battery of vocational interest and aptitude tests to identify suitable careers. B. Helping the client explore the meaning they attach to work, success, and transition, and co-creating a new narrative. C. Providing information about current job market trends and educational requirements for various fields. D. Directly advising the client on the best career path based on their skills and market demand. Answer: B. Helping the client explore the meaning they attach to work, success, and transition, and co-creating a new narrative. This question assesses understanding of a constructivist approach in career counseling. The phrase, "from a constructivist career counseling perspective," is the crucial guide. Unlike traditional trait and factor approaches that focus on matching individuals to jobs, a constructivist perspective emphasizes the client's subjective meaning-making, their personal stories, and how they construct their career identity. The counselor would help the client explore their values, beliefs, and life themes related to work, and then collaboratively build a coherent and empowering narrative for their career path, rather than simply identifying job titles. For example, instead of giving a test and saying you're good at X, the counselor would ask, what kind of story do you want your work life to tell? Remember, Constructivist career counseling is about helping clients build meaningful personal narratives about their working lives. Question 23. A counselor observes a colleague who frequently arrives late to sessions, appears disheveled, and has received multiple complaints from clients about missed appointments and poor follow-up. The counselor is concerned about their colleague's professional impairment. The most appropriate initial ethical action for the observing counselor is to A. Report the colleague to the state licensing board immediately. B. Privately discuss observations and concerns with the colleague, offering support and suggesting resources. C. Avoid involvement, as it is not the counselor's direct responsibility to monitor colleagues. D. Inform the agency director about the colleague's behavior without speaking to the colleague first. Answer: B. Privately discuss observations and concerns with the colleague, offering support and suggesting resources. This question explores the ethical responsibility of counselors when a colleague shows signs of impairment. The concept being tested is peer responsibility and ethical obligation to address potential harm to clients. The most appropriate initial step is to privately approach the colleague, express concerns in a supportive manner, and offer resources or support. This approach respects professional courtesy and provides an opportunity for the colleague to self-correct or seek help without immediate formal action, which should be reserved for situations where direct intervention is unsuccessful or client harm is imminent. For example, a counselor might say, "I've noticed some changes in your work patterns, and I'm concerned. Is there anything I can do to help, or perhaps point you to some resources?" Remember, addressing impairment usually starts with a supportive, private conversation before escalating to more formal interventions. Question 24. A client, recently immigrated to the United States, expresses feelings of isolation, homesickness, and difficulty adjusting to new cultural norms. They are struggling to learn English and find employment. The counselor's most comprehensive initial response should involve A. Focusing on individual resilience building and stress management techniques. B. Referring the client to an English language class and a job placement agency. C. Exploring the client's acculturation process, cultural strengths, and connecting them with community-based support networks. D. Diagnosing them with an adjustment disorder to validate their distress. Answer: C. Exploring the client's acculturation process, cultural strengths, and connecting them with community-based support networks. This question evaluates the counselor's ability to provide culturally sensitive and holistic support to an immigrant client. The keywords recently immigrated, feelings of isolation, homesickness, and difficulty adjusting to new cultural norms, and struggling to learn English and find employment highlight multiple stressors beyond individual psychological issues. The most comprehensive initial response involves understanding the client's acculturation experience, which encompasses psychological, social, and cultural adaptations. It also means leveraging their inherent cultural strengths and connecting them with practical, community-based resources and support systems that address both emotional and concrete needs. For example, connecting them with an immigrant support group can address both isolation and practical resource navigation. Remember, for immigrant clients, a holistic approach that acknowledges acculturation, cultural strengths, and community resources is often more effective than individualistic or purely diagnostic interventions. Question 25. A client completes 12 sessions of counseling and reports feeling significantly better, having achieved their initial goals. They express gratitude and are ready to terminate services. What is the most appropriate step for the counselor to take during the final session? A. Encourage the client to extend sessions to ensure long-term stability. B. Provide a detailed list of potential future challenges and strategies to cope. C. Review progress, discuss maintenance strategies, anticipate future challenges, and process the emotional aspects of termination. D. Simply wish the client well and conclude the session, as the goals have been met. Answer C. Review progress, discuss maintenance strategies, anticipate future challenges, and process the emotional aspects of termination. This question tests the critical process of termination in counseling. The key is understanding that termination is not merely the end of sessions but a crucial therapeutic phase. The most appropriate action involves a comprehensive approach, reviewing the client's progress and successes, discussing strategies to maintain the gains made, relapse prevention, anticipating potential future challenges and how to address them, and processing the emotional meaning of ending the therapeutic relationship for both the client and counselor. This reinforces client autonomy and prepares them for continued growth outside of therapy. For example, discussing how the client will cope with stress without the counselor's support is vital. Remember, effective termination is a planned, collaborative process that consolidates learning and prepares the client for independence.